This is Boomer Life on CL 650.
This is Boomer Life on CL 650. I'm Joanne Sutton, joined today with Maria Howard, the CEO of the Alzheimer's Society of British Columbia. Also with us is Dr. Mari DeMarco, a clinical chemist at St. Paul's Hospital and an assistant clinical professor of pathology at UBC. We've spent a great deal of this hour talking about research for Alzheimer's disease and dementia, what's being done, how it's being done, advances being made, clinical studies, research studies, and more, and of course, why this research is essential. Alzheimer's disease has no cause and no cure, and predictions are staggering on how this is actually going to impact the baby boomer generation. Maria, did you have any information on that or statistics?
Well, I think, the numbers, show that at least in BC, over 70,000 people have some type of dementia today, and that number will continue to grow to almost, 750,000 in the next 15, 20 years if nothing is done. And that's really staggering because people are aging. We know there are more people over 65 than under 13 in BC, but also we know that lots of other diseases are being much better managed, so people are living longer. And so if you start to add all those things together, it becomes really concerning.
Yes, definitely. Joining our conversation right now by telephone, we will say hello to Dr. Larry Chambers. Thank you for joining us today.
Thank you for having me come, Joanne.
So Dr. Chambers is a scientific advisor for the Alzheimer's Society of Canada, and his research and consultation interests focus on epidemiology and program evaluation issues related to healthy aging and dementia. So Dr. Chambers, just tell us a little bit about yourself.
Well, I just was going to mention that I'd like to reiterate what my colleague Maria Howard has said earlier about our Alzheimer's Society research program. Canada has an amazing pool of researchers, and year over year we're seeing an increase in the number of applications the Society receives from scientists. We've just closed this year's competition and have been impressed with the quality of research and innovative ideas. In addition to being involved with this program, I also help the Alzheimer's Society build and facilitate partnerships with other researchers and institutions across the country. Research, is a team sport. We still don't fully understand what causes dementia, as you mentioned, or how to effectively treat or prevent the disease.
How did you make, throughout your career, how did you make that connection with Alzheimer's research and dementia? What led you to that?
Well, it's critical that researchers work together. So I've always worked closely with other researchers in my research career. And this is the way we'll be able to get to the bottom of this disease more efficiently and effectively. So while finding better treatments and ultimately a cure or cures for the disease, research is also key to improving care and support for Canadians who already have the disease and their caregivers. So I'm working with local and provincial Alzheimer's Society partners to build more awareness about the kind of research that is underway in our country right now and encourage Canadians to participate in clinical trials and studies. More participants will help advance progress further.
So your role with the Alzheimer's Society of Canada is as the scientific advisor. How do you bring all those elements together?
Well, we're in constant touch with all the societies across the country and with researchers across the country. We have a small staff, but we are quite connected and well established within the country as far as the research community is concerned, and many Canadians know about our work.
And do you have an actual personal connection to the disease that's inspired you to focus your attention on dementia research?
Yes, I have many friends who have had or have the dementia, and also know many people caring for a family member with the disease. I bet if you were to ask any of your listeners the same questions, chances are pretty high they also have a personal connection. In fact, 3 out of 4 Canadians know someone with dementia. This is a subject that I care about tremendously, and I've spent most of my career in public health, continuing education for healthcare professionals, and improving care for older adults.
Well, I know there's 7 of us in the studio right now, and if I were to ask each one of you to put your hand up if you have a direct connection to Alzheimer's disease. I would count 7 hands. Now, I know that's one of the reasons that has brought us all together today, but I think it's also very relevant for our listeners as well. On today's show, Dr. Chambers, we've actually talked to 2 British Columbia researchers as part of a larger conversation about dementia research as part of Brain Awareness Week. And I believe you can actually talk a little bit more about what we understand about risk reduction now, and what else you can offer about other types of things that myself and our listeners can do to help reduce their risk of developing Alzheimer's disease or other dementia. What can you offer us?
Well, while Maria Howard just mentioned that the baby boom is going to increase the number of elderly people in the country with dementia, the really good news about evidence about dementia is that it appears the number of new cases is decreasing with new people coming into the older age groups, and scientists believe that this declining rate is related to a decrease in cardiovascular disease, and the fact that we're taking better care of our vascular health may be protecting our brain longer from the effects of Alzheimer's disease and other dementias. This is all good news. All things we know about preventing heart disease, such as physical activity, not smoking or drinking excessively, eating nutritious foods, and managing our blood pressure. These all, it appears, can stave off Alzheimer's disease and dementia.
I think, and I'm addressing the group right now, Dr. DeMarco and Maria Howard, that these were some of the things that Dr. Cheryl Wellington also volunteered today.
Yeah, it's certainly an active area of research and some exciting findings that we're seeing, and areas that we'll certainly delve into in the future. Yeah,
it's all about just overall good health, and I guess we never really made that direct connection before. So what are some of the other trends that we're seeing in dementia research these days, Dr. Chambers? Are there avenues of potential treatment that are starting to become more prominent?
Well, Joanne, the brain is a very complex organ, and is one of the reasons why the search for new drugs to treat dementia is moving slowly. Another reason has to do with the fact that we haven't quite figured out the cause or causes of the disease. However, there are 4 drugs currently available that help reduce the symptoms of the disease for a period of time. And these drugs have been on the market for 10 years, but we haven't had any new ones since then, which is why collaboration research is so important. But that said, we're also seeing evidence of care practices that can make an impact on the quality of life of people living with dementia and their caregivers. For example, music and the arts have proven effective in giving people with dementia a better quality of life and a better sense of well-being, more independence, and reducing stress and agitation. Music can even help trigger memories from the past. It's important to focus on the medical, but also to pay more attention to what we call psychosocial research.
Is there anything else that you would like to share with us about dementia research, and also let us know how many years you've been involved with this?
Well, I started working on the Canadian Study on Health and Aging in 1988, 1988, and that was initiated by the Alzheimer's Society of Canada and Health Canada, and we conducted a big study in those in the following 10 years to show that the prevalence of Alzheimer's was quite large, like well over 500,000 people, even then, and so I've continued to be involved in that kind of epidemiologic work, and more recently I've been part of the Canadian Longitudinal Study in Aging, which has 11 sites across the country, and we're following 50,000 people.
So I know you can't look into that crystal ball and make a prediction, but where do you feel we are today with research? Are we on a cutting edge? Are we close? What could you tell us?
Well, I think it's a really exciting time, and I believe we'll beat the disease in our lifetime, and we also are pleased that our new government recognizes the urgency of this disease. Last week, a private member's bill, Bill C-233, in support of a national Alzheimer's disease and dementia strategy, was introduced into the House of Commons, and the Alzheimer's Society has been advocating for many years now that we need a national strategy, and research is a critical component of that strategy. So we're optimistic that we will have a strategy in the near future, and we will continue to work with all levels of government to make this happen.
Any other questions from the panel? Maria?
I think, Larry brings up a lot of really hopeful information for families, and I think, we've talked about the importance of information and understanding, and the earlier this can be done, the better. We know that we were talking earlier with Mari about the need to have diagnostics so that physicians can help think about better care plans and treatment plans. It's also so that individuals who have a diagnosis and their families can make decisions around quality of life and make those decisions when they can still talk about it. So it's really important, as Larry is suggesting, with research on the scientific and the medical front, but also on the psychosocial and the elements of helping people live better lives and continue to live good quality of life. So research really is a thread that is so essential.
Dr. DeMarco?
Yeah, I'd also kind of want to tie what Dr. Chambers said into kind of our earlier discussion around new therapeutics. So we talked about sort of a limited availability of therapeutics to date, and that's really tied in with the research we're doing, because they've shown that those clinical trials that were done where they didn't include biomarkers that helped identify which people had which diseases, they found that they often misdiagnosed people, and so that led to the failure of these clinical trials. So we're really trying to develop these diagnostic tools not only to help patients and families make decisions early on, but also really to accelerate this quest for new therapeutics, so we can get the right people enrolled in the right trials, so that hopefully we can really measure what we want to measure.
And I would add too that the Alzheimer's Society is really advocating on 4 fronts. We're talking about more research on treatment and prevention as one of them. The second one is that we have a lot of work to do to improve the knowledge and the expertise of health professionals and practitioners across the country. Third, we have to find better ways to deliver care to people with dementia and their families. And finally, probably most importantly, more awareness about the disease, as Maria was referring to, so that people see it as a different type of life, but not the end of the world when they first get it, at least. And it is a long process, and there are many ways, as our campaign said in January, to recognize that people are still here with the disease.
Dr. Chambers, we want to thank you for your time today, and thank you for what you do for the Alzheimer's Society of Canada.
Thank you very much for including me in your show, and best of luck.
Thank you very much. Dr. Larry Chambers is the scientific advisor for the Alzheimer's Society of Canada. He maintains an appointment with the Briere Research Institute, also the University of Ottawa, McMaster and York Universities as well, and the Institute for Clinical Evaluative Sciences. He's also won top awards for achievement in health research from the Canadian Institute of Health Research and Canadian Medical Association. Dr. Chambers has been a great contributor on today's show, don't you think, Maria?
Yeah, absolutely. I think all the researchers that we've had today have brought their own specialty and their own expertise, but they all come together so well, right? And that's what is so important about supporting research, and by raising funds and ensuring that the researchers have the resources they need, and that families and people with Alzheimer's have an ability to share their voice and experience into research. So it's great.
We'll say thanks to Maria Howard as well, CEO of the Alzheimer's Society of BC. Also, thank you to Dr. Mari DeMarco from UBC. Thanks for your contributions today as well.
Thank you, and thank you again for raising awareness.
It's my pleasure. We have this conversation once a month, and we look forward to it. Dr. Cheryl Wellington was also part of our show today, Professor of Pathology and Laboratory Medicine out at UBC, and then, of course, Dr. Chambers. We will continue this conversation about the journey of dementia in another 4 weeks. And in the meantime, if you wish to have more information about the Alzheimer's Society of BC, please visit their website, alzheimerbc.org. Of course, you can always ask questions of your doctor, or you can always call us here at the radio station as well. And don't forget to mark May 1st on your calendar for the Investors Group Walk for Alzheimer's. There's one in your community. I'm Joanne Sutton. Thanks for being here today on Boomer Life on CL 650.